Hi, I'm Dr. Tanya. Today is May 11th, and I'm going to be talking about something that I've been working on for weeks with specialists across the country, and that is how we can safely get our children back to school this fall. As a pediatrician, I really believe that kids learn better with the one-on-one interactions from their teachers. And although the school year will look much different this fall because of COVID-19, I do think it is possible to create a safe, engaging learning environment for all of them. Now that said, it will look different from school to school across the country. So I'm going to discuss today some of the strategies that I have come up with and different situations that different schools I've talked to are going to be applying, but you may have to tailor them for your own school district. If you haven't subscribed to my channel, please do, and please share this with your friends and give me feedback, ask questions. That's how we all learn. So in order to get our kids safely back to school this fall, there are three problems that we need to work on solving. And the first one is decreasing the entrance of the virus from getting onto the campus and into the school. The second is to decrease transmission of the virus from person to person while at school. So that's from student to student, or student to staff, or teacher to student. And then the third is when we do have a child who gets sick, and it's probably not if, it's probably when, we will need to identify them, isolate them, test them, diagnose, and then contact trace. And that's really critical to being able to keep the kids healthy and also not to have to shut down the entire school. But hopefully if we do this correctly, it might be that we quarantine maybe a specific classroom or group of students when needed. So let's talk a little more about some strategies for keeping the virus from entering your kids' school. So first of all, you mainly want to do this by adding in social distancing. So perhaps there will be staggered start times of different classes or different grades throughout the school. Buses may run on different schedules. In some schools, they may not run at all, or they might run only for the kids that absolutely need it with social distancing and disinfecting on the bus. When kids do enter the campus, different schools will have different methods of screening. So for some, that might mean no-touch temperature checks, and others it might mean screening questionnaires such as, do you attest that your child has not had a fever today, or any illness symptoms such as cough, runny nose, aches and pains. Some might go as far as to ask about members in the immediate family as well. There might be honor systems at some schools, and other schools will just have to ask the questions directly when the kids are dropped off. We also won't be able to have as many people on the campus, so that means probably parents and volunteers and visitors will not be allowed on campus because the goal is fewer people entering the campus every day. Also, we need to be able to keep track of everybody that is entering the campus, and that's really going to be key. So once the kids are on campus, how do we decrease transmission from student to staff, teacher? And really the goal is going to be by creating smaller groups and social distancing. So for instance, some of the preschools and elementary schools I've talked to are going to make the class sizes smaller. So less than 15 kids per class. Some might be less than 20 or 25. It really depends on what the ability is for your school. And the goal will be for those kids to stay in their own little bubble, cohort, or group and not mix with the other classes, even the ones in the same grade. So ideally, these students would be assigned a seat. That way it's also easy to contact trace when needed. Of course, preschools, they don't have seats. Also, there might be disinfecting going on. So if you're talking about middle schools and high schools where you really can't keep the same group in the same class all day long, the goal would be to make the movement from class to class and around campus less often. So maybe you're going to have double blocks of classes. Maybe certain kids are going to go to school on certain days of the week, or you're going to have morning and afternoon classes just to decrease the numbers on campus. Desks will be spread out to social distance whenever possible. And then also disinfecting is going to play a huge role. So for the younger grades, there's probably going to be hand washing breaks every hour, hour and a half, and that's when they're going to be led through to use the bathroom. And of course, there will be emergencies where kids have to use the bathroom at other times, but in general, we want to keep that group of kids together as they move around the campus, and that way we can go in and quickly disinfect the bathroom after it's being used or another area of the school after it's being used. Kids may also be eating lunch in their classrooms because large lunchrooms are going to be closed because we're going to limit the places where kids can move around the campus, and we're going to decrease the gathering of large groups of kids. So there won't be large lunchrooms, there won't be big groups of kids at recess or large assemblies. These things will be done class by class. So lunches can be brought from home or they can be dropped off in the classroom to the specific student. Assemblies might be virtual, library time might be virtual, and then maybe the library books are dropped off in the class by the librarian. That could be fun. Recess will be staggered. So what you might see is playground structures might be closed, or they might be assigned to one classroom for that day and a different class the next day. Kids will still be able to go outside. It's just going to be a little different. So we might see a lot more kicking the soccer ball back and forth across the field. We might see some old-fashioned calisthenics or just running around. But we're going to avoid having them touch common items unless they can really be disinfected thoroughly. Other things that some schools are looking at is doing classes, especially for the middle and high school students, maybe outdoors sometimes, because that can allow spreading out more and fresh air. And a lot of classes are really just discussion groups, and you don't necessarily need a desk where you can write at. I know this sounds overwhelming and even crazy, but when I talk to teachers and administrators at schools across the country, I'm surprised at how innovative and creative they are at coming up with ways to really de-densify and still teach the kids. Teachers can rotate from class to class while the students stay put. One of the science teachers said instead of going to the science room, she's just going to bring the projects to each class. Now, when kids do need to move classes, that's when disinfecting will come into play. So I could see disinfectant wipes outside the class where high school, middle school students go into the classroom and wipe down their desk and chair before they sit down. And that itself will really help, along with hand washing when kids enter new classes, when they leave classes, and before lunch. In addition, also thoroughly disinfecting every class at night and every surface in the school is going to be very important, especially for those schools that choose to have some students coming on Monday, Wednesday, Friday, and others on Tuesday, Thursday. If you don't thoroughly disinfect at night, then you're going to have the germs from the day before, and in that case, it's kind of like having all those kids in the classroom, at the same time. The next thing is going to be masks, and we know that masks can play an important role in decreasing transmission of the virus, especially because so many cases are from asymptomatic people. Now, teenagers, so middle school and high school kids, they can wear masks appropriately. They know to wash their hands, how to put them on, how to take them off when they need to eat and drink. With younger kids, it can be very challenging. And I don't know yet what the exact guidelines are going to be, but I could see something like masks for third graders and up, but possibly not for the younger kids unless really needed and we teach them, how to properly use masks. There will be some parents, though, who want to send even their young kids with masks, and so that has to be acceptable. So schools might need rules in place about what the masks can look like. Do they need to be solid colors? Because masks are going to become kind of a fashion statement this school year. So you want to kind of have the guidelines set out ahead of time for what you're going to allow at your school. Let's see, what else did we want to talk about? Oh, some schools are actually taking this summer to install extra hand washing stations around the school to get rid of drinking fountains, to add in water dispensers so kids can fill up their own water bottle without touching any commonly touched surfaces. And that's the other thing, is when you're wearing a mask, I find a lot of kids aren't drinking enough. So the masks will need to come off at certain intervals throughout the day for like nutrition breaks where kids can drink water and eat, washing their hands before, of course, and then for lunchtime. So that's something that we will also need to build into the day at school. Now, what happens when somebody shows a sign of illness? And although I hope this doesn't happen, we know that it will, especially because once we get kids back in the same environment, there will be a little bit of germ sharing no matter how much we try to decrease it. And we will also be going into cold and flu season again this fall. So it's only natural that we are going to have sick kids. So when a child is identified as being sick, let's say they have a high temperature in the morning when they come in for screening, let's say they're coughing, let's say they have a runny nose, they should be immediately removed from the classroom. Even a little bit more vigorously than in past years where it was like, oh, it's just a little cough, but they don't have a fever, they're doing fine, let's leave them there. I really think in these situations, the children are gonna need to be taken to the nurse's office, evaluated and isolated from everybody else. The nurse should be wearing a mask and hopefully a face shield, proper PPE to protect themselves while they check out the student that's affected. And then we will need to be able to test kids. And this is going to depend location to location across the country. Testing is going to be the most important thing. And hopefully by the fall, we will have better ways to rapidly test kids. There might be faster nasal swab tests, like when you go to your doctor's office now and they swab you and they run a test and say, oh, it's not flu, it's not RSV. We are going to need to test these kids for COVID very quickly in order to be able to get them back to school, because some kids will have runny nose and coughs all school year, and we don't want to keep them out of school the entire time. So we're going to have to be able to determine, is this COVID and can they get back to the class? Kind of like during pertussis outbreaks in the past when schools have said that kids with coughs cannot return until they have that negative pertussis test. So negative COVID testing is going to be very important to keep as many kids in school as possible this fall. Also, there's going to need to be a place for kids to be able to sit and wait for parents to pick them up, since we know that some parents may be at work, they might be an hour away, and you'll need an isolation room on campus or a place outside where kids can safely wait without exposing others while parents do pick them up. This also brings up the topic of online or virtual learning and how that will play a role this school year when we also have the in-person brick and mortar school day going on. And there will be families who may not feel comfortable sending their kids to school. Maybe their kids are high risk because they have underlying illnesses or diseases that make them more likely to get seriously sick. Or maybe kids will need to stay home and be quarantined because they're sick and we're waiting on a test, their sibling's sick, someone in their class is sick. So we will need to have options for virtual online learning at the same time as in-person learning at school. And this may vary from school to school, but it's something that we're going to need to see universally. In addition, when there are outbreaks at schools, we may need to, with a flip of a switch, go directly to online learning, either for classes or grades, or even the entire school. But by grouping kids in small cohorts, that will really help so we don't have to shut down schools and we can just really go section by section as needed. So this is going to really take a collaborative approach across the entire country with families, which includes the students and the parents, also the teachers, staff, and administration at every school, because every school is different and really has unique circumstances based on the size of their school, based on the size of their campus, and based on the area of the country that they're in and how many positive cases we're seeing, what their ability is to spread out, and how rapidly they will be able to test and diagnose kids who are sick. So I encourage you all to have conversations with your local schools and your local school districts. And let's not forget that public health plays a critically important role in determining when different schools across the country will be able to go back to school and use some of these guidelines that I've talked about today. So if you have any other thoughts, suggestions, creative ideas, please leave them here. We are all working together across the country to be able to create a safe and engaging environment to get our kids back to school this fall. And if you haven't already subscribed to my channel, please do. I come to you every Tuesday with Dr. Tanya's tips to keep your family safe and healthy.